Hi, I'm Linda Stewart with the Division of Children and Youth Services of the Department of Mental Health. Today we'll be talking about individual service plans. The Mississippi Department of Health provides hope by supporting a continuum of care for people with mental illness, intellectual or developmental disabilities, and alcohol and drug addiction. Services are provided through our state-operated programs and community service programs, regional community mental health centers, and other nonprofit service agencies and organizations. The treatment plan or individual service plan is the path that a person follows on his or her journey through treatment. There are different paths that treatment can take. It's important to understand that just as each person is unique, each treatment plan or individual service plan is unique. No treatment plans will be exactly the same because no two people are the same. So you may have a child that has attention deficit hyperactivity disorder or attention deficit disorder. These children will not exhibit the same symptoms or behaviors, so naturally their treatment plans will not look the same. In addition to that, all people have different strengths and different needs. So that also plays into the fact that no two treatment plans will look exactly the same. All persons receiving mental health services must have an individual service plan. The individual service plan must be developed with the person or with the parent or guardian for persons under age 18. Or for those who are unable to effectively participate in the treatment planning process. Those individuals will need help with parents or guardians or other family members helping them to complete the individual service plan. The ISP or individual service plan is based on strengths and needs of the person. The needs of the person were documented in the initial assessment when the person initially came in. The ISP includes the goals that will address the person's needs. These needs, again, were reflected on the initial assessment when the individual came in at the beginning of treatment. The ISP identifies the activities that will occur and the interventions that will be utilized to achieve that person's goals. The person or parent or guardian must be offered community support services. Community support services are mobile services that focus on increasing the person's ability to succeed in the community. Community support services assist in identifying and accessing services in the community to promote improvement in school, work, family, and community participation. Community support services are the grassroots of our public mental health system. The community support specialists are mobile. They go out into the community and help the family or the individual or the child access services that they otherwise could not access. Next, on to the long-term goal. The long-term goal is written as stated by the person or the parent or guardian if the child or youth cannot state their long-term goal, and it's stated in their own words. Information about the person's long-term goal can be obtained by asking what the person or the parent or guardian hopes to achieve. Some persons, parents, or guardians may need guidance in stating the long-term goal by asking questions like, what would you like to see changed or different in your life? What would make your life satisfying? An example for a child or youth for a long-term goal would be something like this. I want to have good days at school and not get into trouble. That might be an example for a child or youth. An adult might say, I just want to get a job, or I just want to be able to get out of the bed. That would be an example of a long-term goal. The long-term goal is written as stated by the parent or guardian in his or her own words. Information about the person's long-term goal can be obtained by asking what the person, parent, or guardian hopes to achieve during treatment. Some persons or parents or guardians may need guidance in stating the long-term goal by asking questions like, what would you like to see different or changed in your life? What would make your life satisfying? What would help you feel better? Some examples of some long-term goals for an adult might be, I just want to get a job. Or they might say something like, I just need to be able to get out of bed in the morning. I need to be able to manage my children without getting so frustrated. Things along that line. For a child or youth, it might be something like, I just want to do better in school. I want to have good days in school. I want to be able to pass and go on to the next grade. The short-term goals are the small steps that need to be achieved to reach the long-term goal. Short-term goals are goals that can be achieved in relatively short amount of time. from a month up to a year. Typically, your long-term goal is going to be, you want that person to look at achieving that goal in up to about 3 years. Your short-term goals are much shorter, and the timeline is much shorter. They should be able to be working toward that and making good progress within a year. No more than 3 short-term goals should be developed with the person or parent or guardian to facilitate achievement. You don't want to give them too many goals or objectives to achieve, otherwise they can become overwhelmed and no progress is made at all. Target dates for short-term goals will not have all the same target goals. Some goals, such as medication monitoring or linking someone through community support services to a needed service in the community, that should not take a year. That should be more like a month, 2 months. We want to make sure that individuals are seen for medication within that month, and linking someone to a job may not take that long. Beginning with filling out an application, that might be a short-term goal. So that shouldn't take a month, shouldn't take 3 months for sure. So all target dates should be different on your individual service plan, and they should relate to the goal or objective. Individual strengths. The person, child or youth, or parent or guardian may need assistance to verbalize their strengths. Not all individuals are comfortable with stating what their strengths are, what they're good at, or what they feel like, is a strength for them. So you may have to help them do that. Strengths identified must be strengths that will promote achievement of the short-term goals and will eventually be reflected in the progress notes. So the strengths that you place on this ISP you should see in the progress notes. Each strength listed on the ISP should be written in the form of a phrase or a complete sentence and should include why it is a strength. So, an example of a strength for a child or youth who may be having trouble at school should say something like, has a good sense of humor which endears him to others. So you're explaining what the strength is and how it helps him. Likes to write or draw can be another strength. And then again, you would say why that particular skill or talent helps that individual. Something like, it calms me down and makes me feel better. Those are the exact words of the individual. Family support can also be a strength. So for a child or youth who you may want to state, or they may state that their family is a support, and this is how that would look. Grandmother provides shelter, food, and clothing for child. Those are just examples. Hopefully that will be helpful to you. You need to remember that strengths can be skills, personality traits, talents, or other things. Making sure when you identify the strength on the ISP that you also identify why that is a strength for that individual. Barriers are behaviors, thoughts, and feelings or life circumstances that have prevented a person from achieving his or her long-term goal. Barriers can be identified by the person and or obtained from the DMH approved functional assessment utilized by your agency. Barriers may be present in the person's life at home, at school, work, and or in the community. Some examples of some barriers for a child or youth that we've been talking about that's having trouble in school might be something like this: fighting with peers at school to cope with anger or sadness, poor interactions with teachers and grandmother, frequent suspensions from school for fighting and challenging authority figures, partially completing their schoolwork. You want to make sure and state these barriers on the ISP in positive terms that are as encouraging as they can be. It's hard to do that with a barrier, but we want to make sure that our words on the ISP are encouraging to our parents, guardians, children, and adults. Areas of need. This is a section on our treatment plan that has been with us for a long time. It can be identified by the person or obtained from the initial assessment. It lists symptoms and or problematic behaviors, including the frequency or how often the behavior symptom is occurring and the duration, how long it has been occurring. Both of these are identified and documented on the ISP. Also, the risk of continued symptoms or behaviors without treatment and the impairment in functioning that is observed are identified and documented on the ISP. So you want to put on the ISP in this area of need section what would happen if the individual, child, youth, parent, or guardian was not in treatment and did not receive treatment. What are the risks? What could happen? So that might say something like, the duration and frequency component might say something like suspensions due to fighting with peers, not following the classroom rules, and threatening to destroy the classroom property. Then your duration might be 1 year, and the frequency could be every 2 weeks. Listing the limitations or the risk might go something like this. John is frequently suspended and is in danger of being suspended and or becoming involved with the juvenile justice system without intervention. The next section on our ISP is individualized plan for services. This is where you're going to list your objectives, your interventions, the criteria or what you would like to see them achieve, and the target dates. Objectives must relate to the short-term goals identified to reach the long-term goal. Those short-term goals were the three steps that were going to help the person, individual, or child reach their long-term goal. Those 3 steps that were listed by the long-term goal. These objectives relate to those short-term goals. Objectives simply state what the person would like to achieve. So it could be simply stated something like this for an objective. The child will improve his anger management to decrease fighting with peers. Something very simple. Interventions are the tools that the staff would utilize to help the person achieve their objective. These can be evidence-based practices, actions, or interventions by the staff person in that particular service area. An intervention for a kid or youth, child in day treatment might say something like this. Participate in an evidence-based curriculum such as skill streaming, focusing on anger management skills and conflict resolution. For a community support specialist or community support activity or intervention, it might simply say something like, link family to the county Medicaid office to explore benefits. Service area assigned. Service area assigned is the service that will be provided to facilitate achievement of the objective. Those services include services that are certified by the Department of Health, such as psychosocial rehabilitation services, day treatment services, individual therapy, family therapy, community support services, peer services, medication monitoring and evaluation. Those are all services certified by the Department of Health and can be listed here in the service area assigned. Physician psychiatric services, that's another one when you're dealing with medication. Criteria outcomes for completion are where you will list and where you will include the measurable component for the objective. Make sure they are SMART, S-M-A-R-T, specific, measurable, attainable, relevant, and time-based. You want to be as specific as you can, not listing something like, you do not want to say something like disruptive behaviors, emotional problems. You want to be very specific. What behaviors, what emotions? You want to make sure that the measurable part of this component is attainable. If a child or youth has been throwing desks out the window for the past year, they're not going to stop that within 1 week. So we need to make sure that we slowly titrate the negative behaviors down that we want to make become extinct. We want to make sure that we don't put an unattainable goal in front of the individual so that they can't see success. We want to make sure it's relevant, making sure the outcome or the criteria that you want them to achieve is relevant to the objective that's stated. And we want to make sure they're time-based. We want to put those target dates in there. The time that the objective is initiated, and then the time when we hopefully that it will be achieved. So, criteria or outcome might look something like this. The child will demonstrate 3 coping skills for feelings of anger to reduce disciplinary reports to once per month. So you have the specific behavior you want to see in that criteria outcome. You have, it's measurable, it's attainable, it's relevant, and it's time-based within 3 months. That target date can be within 3 months or longer if you feel like it needs to be longer or shorter. You also want to make sure that you have evidence there. The evidence for that particular criteria outcome would be the disciplinary report and receiving that once per month and reviewing that with the individual. If they don't get any disciplinary reports, then that child is making progress. Target dates are not typically the same for all objectives, as the achievement will differ for each one. So if your intervention is, or your service area assigned is psychiatric or physician services, hopefully that appointment will be made within the month, so that target date would not need to be longer than a month. If it's a certain skill that the individual or child is trying to learn, that may take a little bit longer. It may take 3 to 6 months, or 4 months, or 8 months. There is no specific time frame that needs to go here in these target dates. Please just make sure that they are not all 1 year. Please make sure they are related to the actual outcome that you want to see. Diagnosis is our next section. All DMH certified providers use the DSM-5, which is the current one, for diagnostic purposes. The multi-axial system for documenting diagnosis no longer exists, so we now have just a primary diagnosis and a secondary diagnosis listed on our ISP. The primary diagnosis is the diagnosis that is the reason that they came in for services, or the mental health condition that is the reason for the referral. The secondary diagnosis is the diagnosis that may have existed prior to the admission but was not the cause of the admission or the reason for treatment. For questions or information, you can contact Carmen Weaver at 601-359-1288. You can also reach her through email at carmen.weaver@dmh.ms.gov.